I am Dr. Raymond Pan. I'm a child and adolescent psychiatrist at the University of Pittsburgh. I'm a first generation Chinese American. My parents immigrated, um, and certainly I'm excited to tell you about my journey into child and adolescent psychiatry. When I was in college, I was interested in neuroscience. Um, I, while in college, I was aware of people with depression and anxiety and how that affected their lives. And I felt that people who struggle with mental health disorders um, are generally underserved population. So I felt that that was an important area of medicine to try to explore. And as my training progressed, I found a lot of personal rewards in addition to feeling that it was a noble area of medicine to pursue. Yeah, so in college, my mentor was an expert in stress. I went to Stanford University, and my mentor was Dr. Robert Sapolsky. He's very well known and writes a lot on this area. So um, I did some research on stress and aging, and I found the interface between stress and mental health to be a very important area and very interesting. Yes, I'm a distinguished fellow of both the APA and ACAP. This annual meeting, I will be presenting at the annual conference. I have so in ACAP, I'm involved in the Adolescent Psychiatry committee,
Yes.
and we have a group looking at how to reach adolescents and how to get adolescents connected with treatment. In addition, I see people in um, the sports concussion program at UPMC and which is the University of Pittsburgh Medical Center.
Yes.
And so my research interest is mood and anxiety symptoms associated with concussions. So I'll be presenting with two other members on traumatic brain injury and mental health uh, symptoms associated with traumatic brain injury. Well, I think the most important thing about being a child psychiatrist is the challenge of being able to reach children, um, and also how important it is in terms of um, if if you could treat children effectively,
Yes.
then there's a long trajectory of life that's ahead of them. So consequently, there's a lot of hope that um, the trajectory of the children's lives is improved. And there's a lot of research on, um, you know, uh, adverse childhood experiences and such, and recurrent depression that you know, at least to me, makes me feel that child psychiatry is a very important area. Early in my career, when I was a medical student, I had the opportunity to work with Melvin Lewis.
Oh,
Actually, working with Melvin Lewis is probably overstating it, but certainly having him as a teacher
yes.
when I was visiting at the Yale Child Study Center. And of course, for many child psychiatrists, Melvin Lewis is a giant in the field. And one of the things that I was impressed from him was that our thoughts about child psychiatry has changed. As many of you know, that he wrote one of the most influential textbooks in child analysis psychiatry. And he showed me the different organization between the first edition to subsequent revisions. And he also impressed upon me that the challenge of building rapport and interviewing a child is such that you'll never do a perfect interview. So I must admit that as I was looking at different fields of medicine to study, that certainly that is the time I spent with Dr. Lewis was probably a major milestone for me. Yes, I think he was my second major mentor. I must admit that um, around the same time when I was experiencing, was looking at different fields, I was able to also work with Tony Angelonis at the University of Connecticut. And Tony Angelonis, unfortunately, passed away early, but certainly he influenced the selection of which residency program I decided to go, and certainly, helped me along in my career. My medical education was at University of Connecticut, and that's where I met with,
Yes,
where Dr. Angelonis
yes,
was the chief of child health psychiatry.
wonderful.
Well, I think that the major barrier is that um, as a minority, you don't have a lot of um, major people in the field that look like you,
Yeah,
right? Or have the same experiences as you. So um, I think there's a little bit of challenge to kind of see how you fit in a field. I think that especially in psychiatry, culture
yes,
plays a major role in not only individual development, but also the sense of self in a community. So I think those are certain things that minorities, medical students aspiring to a career in medicine, have to, have to kind of figure out, which is different than many of other medical students. No, actually, interestingly enough, I did not find a lot of obstacles for by parents or patients. I think one of the, I guess, I think the word might be sad. Uh, Problems about child adolescent psychiatry is access. Mostly parents and children are delighted that you have an interest in them
yes,
and that you're willing to treat them. Um, I must admit that a lot of the barriers had to do with in medical school with doctors in other fields, right? There's a feeling that psychiatry is less than medicine or surgery. There's a misconception that um, that what we do are limited, or what we do borders on other fields that perhaps are seen lesser than medicine, such as social work. So I believe those things were more of a barrier than my patients. There's greater appreciation about the importance of mental health um, as time went on. I think that many people would regard mental health as important as physical health at this point. I think earlier in my career, it um, it was not seen that way.
yeah,
Okay, well, I think child psychiatry is important as a field, But I think what your question points out to is how rewarding it is to the individual who chooses this perfection. I think that one of the amazing things about psychiatry is that you get to understand a person, I think, more thoroughly than perhaps somebody who treats people on a physical basis. And I don't belittle any other field of medicine, but I believe that um, we have the privilege of attempting to do a full, comprehensive interview, and people are often willing to share with us information that perhaps they wouldn't share with their primary care physician or other physicians. And so just being able to talk with people in, I guess, for lack of a better term, in a more unguarded moment allows you to get insight into perhaps what is concerning the individual, and also, what sort of potential psychopathology there is. Well, I think that you probably join me in this is that, child psychiatry is a very underserved field. And perhaps, I mean, of course, this is of no exaggeration. I believe it is the most underserved area of medicine. So certainly the rewards are great, but the need is even greater. I just wanted to conclude by saying, thank you for being a part of this. I think this is really important that uh, we provide access to people interested in this field to see that there are minority psychiatrists and adolescent psychiatrists that, in fact, people that perhaps have never met with a psychiatrist or child as a psychiatrist could actually see this video.
Yes.
And so I think this is very important. So I appreciate your time and joining me today.